So welcome everyone to our forum on collective impact, sustaining and growing our community collaborations. This is our final in our series of 5 free e-forums on specific topics related to community mobilization and youth life promotion and suicide prevention. These e-forums are part of the Ontario's Youth Suicide Prevention Plan, which supports Ontario's mental health and addiction strategy. Today our presenter is Paul Bourne. Paul is the president and co-founder of Tamarack, which since 2001 has provided leadership in Canada on issues of citizen engagement, collaborative leadership, and community innovation. More than 12,000 subscribers engage in Tamarack learning communities. Tamarack also sponsors Vibrant Communities Canada, active in cities across the country, and so far has reduced the impact of poverty for more than 200,000 people. Prior to Tamarack, Paul was the executive director and co-founder of the Community Opportunities Development Association, one of Canada's leading community economic development organizations, which is recognized by the United Nations as one of the top 40 projects in the world. Paul was elected into the world's largest network for social innovators as Senior Ashoka Fellow in 2013. So before I let Paul take it away, I just wanted to cover a few logistical pieces for today. So the slides for today, as well as the recording of this event, will be made available online following this event, and we'll share the link through the chat box in a moment. Also, if you're interested in receiving a participation certificate for today's event, please contact myself and I can get that to you, and I'll put my contact information as well in the chat box in a moment. Any questions you have for Paul can be directed through the chat box throughout the presentation, and we'll take those questions up towards the end once Paul's finished his formal presentation. And I think that's about it, Paul. So if you wanted to go ahead and take it away, I will turn off my webcam now.
That's great. Hi, everyone, and thanks so much, Christine, for that. It's wonderful to be here with you. And given that we're a small group, do fire me off some emails. Sorry, Christine, I was looking down here. It was Sophia that was sharing with us. But do send questions and comments throughout, and I'll either take them as they come, or we can always wait until later. I'm really happy to be here. The work you're doing is some of the most important work that is to be done today. When I was running CODA, the Community Opportunities Development Association, we merged with Lutherwood to create an organization called Lutherwood CODA. And many of you know the work of Lutherwood here in Waterloo Region and their groundbreaking work in children's mental health. And on a more personal note, 3 of my very dear friends, some of our best friends, have had children with mental health issues, and those have gone on for many years now. Luckily, they've become adults, and at least 2 of those children have taken on to take on very productive lives. But boy, we spent many a time with these families and with these children, and we just know how important the work that you're doing is, and the kind of support that you're able to give these families, and the help that you're able to give to these children. So thank you so much for that. I want to sort of put some context here around who is Tamarack, and why do we even care about collaboration and collective impact. I mean, first of all, what's so important here is that we don't do this work because we want you to become better collaborators. Well, maybe we do, but we only want you to become better collaborators because we want you to have higher impacts. We want there to be changes. We often think about, questions, and I'm thinking of one for you. How do we create communities in which children children's mental health is always healthy. How then do we live within as a community, as people living in that community? How do we live in terms of being able to respond? And then how do we learn to live with each other that's differently? And I know that many of you are working in this context where you're trying to create kind of an understanding about how do we create a community that that cares about mental health, and maybe not just cares about it and saying, oh, it's an important issue and we have to do something about it. Maybe we care more about how do we create a community that recognizes it, that doesn't stigmatize it, that works together to support children that are struggling. How do we create institutions that are not only sensitive to this on a policy perspective, but that are committed to it as individuals, and that don't fear it, that are there, that are willing to work with it. In a sense, how do we create a collaborative culture that allows us to catch the issues that children are facing early on, and willing to address the systemic ones that may be causing stress for young people. So that's why we're so interested in collaboration, and why we care so much about communities and what they are. I've written 2 books. Both of them are become Canadian bestsellers. One is called Community Conversations, and it's just really about this whole notion of how do we work better together in communities? How do we bring people together and create these communities that care? And my latest book, which has just gotten to become a Canadian bestseller, is just about a year, 14 months out, called Deepening Community, Finding Joy Together in Chaotic Times. And it's been very well received. I love this quote. In many ways, it summarizes so much of what I believe. When we ask who cares, we invite in others who are passionate about an issue. And when we ask what's possible, it opens us up to unprecedented creativity. So when we're moving out, maybe this is my first slide in terms of what do we do? How do we create these kind of large-scale collaborations in these types of communities? Well, one of the most important things we've learned is to not ask what's wrong first, and then how do we solve it, which is so often how we move into a collaboration. We don't like something, or we're trying to solve a problem. But rather, we're really much more interested in asking the question, who cares? Who cares about children's mental health? Who cares about supporting young people in this way? And then we begin to reach out and we start to see, man, there are a lot of people who care. And they're not always the professionals that are just in this room asking that question. They're the parents, they're people in government, they're other agencies that work with us. There's all kinds of people that care. And then the question is, can we bring them in? Can we invite them in to come work with us? Can we create this type of collaboration? It's interesting. Several years ago, I was working in Alberta, and they had asked me to have a dialogue with all the Aboriginal communities in Alberta. And they asked us to see whether we could form some sort of collective action around why so many Aboriginal children are taken into care. Don't know if you know this, but 68% of all the children that are taken into care in Alberta are Aboriginal children. And yet they only represent 7% of all the children of Alberta. It's a remarkable statistic, really. And we're trying to understand, why does this happen? Why does this occur? And so we went out to the communities, and we started out by mapping every community. There were 10 geographic areas, and we mapped out in those communities all of the people that we thought would care about this issue. We call that the system, convening the system. And what we did is we picked one issue, and that issue was a child is taken into care. The moment a child is taken into care, and we said, who are the people now that could get involved at that very moment? And we mapped it out so that we had a circle. So 32 different agencies or individuals were identified. Everything from the mothers who've lost their child to the mother that's taken the child in and the families, the caseworkers, police, the mental health workers, the psychologists, the doctors, um, and the list just goes on. And we mapped all of those out. And that's who then we invited. So we would invite 100 people per region to come into a conversation for an entire day and to explore why is it that so many Aboriginal children would be in care. Um, and one of the things that we did is we also wanted to make sure that when we invited them, at least 60% were Aboriginal, with a high emphasis on bringing children into the conversation that had been in care, particularly that they're older, maybe 16 and above, and mothers that have either taken children into care or have lost their children to care. And so we put a lot of effort in bringing that community system together of professionals and everyday people. And then we ask ourselves, we ask in there over a period of a day 4 questions. The first one was, why is it so important that we are here today? And really asking that individual question, why is it important that I am here today? That's such a benign question. But when we were able to have a mother who had just lost their child to care, a mother who had taken a child into care, not the one that had been lost, and a caseworker who had at one point taken a child into care. And for them to spend the first half an hour in a triad sharing their individual stories of why is it important that I am here today. So that's a very interesting understanding and taking. So what happens then is that just in that humanization of that moment of understanding that we're all here and we all care was incredible, for us. The second question we asked then, what's happening now? So another benign question, small question, but what we wanted to do is we wanted to create the questions that no matter who was in the room, they would all feel like experts. And this question of what's happening now really allows you to do an environmental analysis, both of what's happening in the communities and what's happening within the organizations that are working within the community. So it's a fascinating question. The third question then was, what's the change we want to see? And then our fourth question is, what can we do together? Why is it important that I'm here? What's happening now? What's the change we want to see? And what can we do together? And this led then to the foundation of us coming up with a plan, which we called a system-wide plan around what it is that we could do differently and what it is that we could do together as a collaboration to change the conditions for Aboriginal children. I tell that story not only because of this slide and it making the point, but also as a methodology, an applied methodology for the work that you're doing. If we truly want to create the kind of communities in which children have healthy mental health, right? And that we're concerned about how we live within, how we think about children, and how healthy we are and the context that we create with them, and how we live together as human beings, right? So if we want to create conditions for mental health, and we want to create the kind of people that care about these issues, and that we are collectively addressing the issues and collectively creating a community around our children that are experiencing mental health issues, how do we collaborate? And I guess, what I'm going to talk about more today is methodologies by which we can. But it really comes down to this very human exercise of understanding who cares. What's that diverse community of stakeholders, being the parents, the children, their grandparents, all of the professional agencies at all levels, not just the ones that have direct service for children's mental health, but beyond that, right? The RCMP were big players in all of our conversations. At the end, we had conversations with 1,100 people. I can go into much more detail about that experience if you ever want to replicate it in Ontario. But it's just an interesting understanding that when we convene the system and we have a dialogue with them and we truly have representatives from the entire system that cares, the dialogue is very, very rich and things change. Now, what's interesting is by the time these dialogues were over, we had reduced the number of children in care by 2%. Now, did the dialogues do that? Don't know. A number of things were happening. What I do know is that when all of this started, there hadn't been a reduction in the number of children in care in a very, very long time. Now, obviously, for them to do something like what we were doing, it makes sense, and it would seem that there are a lot of priority things going on at the same time. It doesn't matter. At the end, the kind of conversations we had, we knew they had a very powerful effect and that things changed a lot. I want to talk about how do we address community problems and the kind of problems that we need to address and the kind of solutions for them. And basically what I'm trying to answer here, just going to get a drink of water, is should you be using collaboration? Is collaboration the right methodology for you? And when do you use it? And I'm the first to say, and many consider me an expert on collaboration. I'm the first to say that it's not always useful. And matter of fact, a lot of times it's a waste of time. Now, I know some of you are shocked to hear that because you're forced to collaborate on just about anything. But let's just take you through this. And Brenda Zimmerman taught me this one, and I love it because it kind of says that there are three kinds of problems. And she says the first one are problems that are like baking a cake. They're called simple problems. Basically, the kind of problems with the right recipe, and if you get the recipe right, then you can often get a good result. And often in psychology, we can teach people about certain kinds of problems, and if we apply the right methodologies, we often get consistent results, which is why we continue to do those. I know that's very controversial what I just said, but let's just say that. But let's just stay with the case. Problems that have easy solutions. Building a children's playground is often one of those that I need. We don't need a collaboration to do that. We might need to collaborate, but we don't need to build one for that. The second kind of problem that she talks about is what she calls complicated problems. Well, these are kind of interesting, and she calls it sending a rocket to the moon is her example. If we have the right formulas and we have enough experience over time and we make some mistakes, we can create a successful. It gets easier and easier, and we get better and better at sending rockets to the moon. So we have simple problems and we have complicated problems. Well, then there's a third kind of problem, and she calls it the complex problem. And she says it's like raising a child. What she would do in the exercises is she would say, put up your hand, and she would say, how many of you have children? And lots of people would put up their hands, and he says, any of you have two? And lots of hands would go up. She says, do you ever wonder if those two actually came from the same parent? And we would often laugh because it's just so evident, right, that our children are so different one from another. Well, these is how she talks about complex problems. And she talks about there's no right recipe to raise a child or protocols. And outside factors influence a lot of the behaviors. And experience helps. You know, the more experience we have with children, the better we can do it. But it doesn't guarantee success. So raising one child a certain way, having lots of children, also doesn't change things. So it's just kind of an interesting um, dialogue and understanding. And so what we're saying is that with simple problems, it might be good to collaborate, but to put a full-blown collaboration together seems a bit overkill. Complicated problems, um, I think we need to work together really, really well. And many of us already do, and many of us would maybe see the work that we're doing as complicated. But when you start thinking about complex problems, the very nature of them is that they're hard to define. And children's mental health has to be one of those. They're both hard to define and they're adapting all the time. So it changes. Children's mental health is always changing. And there isn't necessarily a consistency. One child's mental health would have a lot of factors that would go into it. And though you can group them, ultimately, um, no child is the same and none of the problems are exactly the same. And so what we're looking at is when we're wanting to address issues that are that complex, now we want to start thinking about large scale collaboration. I don't know if any of you have ever seen this slide, but it's called the Collaboration Continuum. And when we start talking about large scale collaboration, we're starting to integrate systems. And just beyond even that, or maybe in between collaborate and integrate, is this notion of collective impact that I'm going to talk about in a little while. But you know, even competition is a form of collaboration. It's a system. We've created rules. Now we're competing with one another, but that is a form of collaboration, right? Then we've got coexisting, communicating, cooperating, coordinating. Many of us are in that phase of coordinating our services. Um, and we're looking for something more because we've come to realize that coordinating our services is not getting the kind of results that we want. I remember a CEO in a local hospital in an organization that I was working with um, said to his group, hey, you know, we've been meeting for many years, we've been coordinating services, getting to know one another, and just, you know, we've done this for like 17 years. And he said, though I found these meetings all very helpful, I've actually never found them of any use. So he's found them useful, but never of any use. And that just meant that they never did anything together. I mean, for 17 years, they collaborated, but they never actually collaborated on a project that changed the conditions for health in their community. And I find that to be very telling. And almost everywhere I go, uh, collaboration has really stalled at that level. It stalled at the level of us communicating with one another, but not actually communicating in such a way that we would be collaborating with one another and connecting beyond that. So we cooperate, but we haven't, and we maybe coordinate, but then we start to collaborate and we start to say, how do we go further? And how do we work together as a system to improve the conditions for children's mental health in our community? And that's what I want to talk about next. Um, you know, this slide below, the blue and the purple, it also talks to you about the blue. And I often talk to people about, if I had a little more time, I'd go into this in some detail. Maybe you can ask that question. But look at here, you know, how much trust it takes. The higher the collaboration, the more blue that has to be there. Now that blue is relationships. The deeper relationships get, the more work we put into this, the more work we get into knowing one another. It's very good. So hey, look, we've been coordinating for a long time. We've built a lot of trust. we have we have what it takes to take collaboration to another level. And that's where I'm going to now start looking at. I've already talked a fair bit about community systems, and I'm going to go there in a little while. But I think I'm going to move here and feeling like we're ready to come to this level. And let's talk about community systems, and particularly around questions that you might have, because community systems are what we need to understand in terms of how we affect them for greater change. I'm going to go there in a minute, but let's talk about collaboration now, and let's try to say, how do we get beyond coordination, and how do we move to another level of collaboration in which the work that we are doing together is going to help us get better results for children. And how do we do that, right? And how do we make this extremely important in the work that we're doing? So there is this new thinking that has emerged. Well, I mean, it's not that new anymore. It's been almost 3 years now from its early days to its full-blown thinking, and it's called collective impact. I wish I could have a way, maybe we should take a poll. How many of you have heard of collective impact or have done collective impact in the last 3 years? It's kind of an interesting thought. I know we can do some form of polling here, so it'd be kind of interesting to do.
I'll pull one up right now.
Oh, thanks. That's fantastic. Just something so we could interact with. But while we're doing that, let me talk about this. Okay, so people say to me, Paul, I know collective impact, or once you tell me about it, it looks real familiar. And I say, of course it does, because you've been collaborating for a long time. I said, but how many of you feel that if we keep working the way that we do, things are going to get a lot better for children? I say, like, if we just all worked a little bit harder, right? Is that going to, maybe we could take that vote now. How many of you have been involved in collective impact or have heard about it in the past? Oh, it's changing. Here we go. Okay, well, that's great. So it's good. So we're at this level where most of you have heard about it, and we can talk about that in a while. Like about 80% of you have both heard about it, and maybe we could ask the one, how many of you have implemented a collective impact program in the last year? Maybe we could do that second poll, because we're about 83% of you have heard about collective impact. Let's see how many of you have actually done collective impact in the last year, or implemented. Done, implemented is good. And I guess the question is, it depends. I'm quite sure is also going to be part of this vote. So as you're voting, I want to talk to you a little bit about how I see collective impact, right? And here again, it's almost identical. We've got the vast majority of you have not done it, but the vast majority of you have heard about it. And let me talk to you maybe in a sense about why it would be so great for us to move to this next level. So this has been my experience. And I'm going to tell you a quick story about how I got involved in this work. And it's been about 12 years. So we're one of the founders, one of the key thinkers. And Community Conversations, when you read the book, it's got all the principles of collective impact, but just uses different language. And that's why when John Kanya heard about our work, one of the first writers about collective impact, he immediately started working with us. And now we're teaching right across North America. Matter of fact, in Halifax, in April, we're going to be running another 3-day collective impact workshop with John Kanya, with Faye Hanley Brown, and all of the founders of the collective impact movement. We've been doing that for years now, both in Canada and the United States. So I'll tell you my story. It started like this, you know. I was with the Community Opportunities Development Association, a community economic development organization, and we were awarded one of the 40 best practices in the world for our work. An amazing honor, really. And we had a big celebration. Nicholas Yu flew in from Nairobi. Our mayor invited all the other regional mayors, and we had a big celebration, around 300 people in the most historic building in our community, and had lots of great, exciting speeches and congratulations and all of that. And then I was brought up at the end to say, um, do you, would you come and accept the award? So I came up and accepted the award, and I was asked to give a little speech, and I said all the right things. Of course, I'd been an executive director for a while and thanked everyone and so forth. But I ended the speech like this. I said, I find it curious that you're awarding us as one of the 40 best practices in the world. And in reality, yeah, there are ways that we deserve this. We've helped a lot of people get back to work. We've helped a lot of small businesses. We've helped a lot of people in poverty live better lives. But do you know that the 10-year period, so this is the award was given for a 10-year review of your work. In this 10-year period, poverty actually has increased in Waterloo region by 5% in those 10 years. So things have gotten 5% worse for people in those 10 years. And here we're getting, as the largest agency that works with them, here we're getting an award for being one of the best practices in the world. So I said, I actually think, when I hear CEOs of corporations, when they lose shareholder wealth, they don't get prizes, they get fired. I said, with all due respect, I can't accept this award today, and in reality, I think you should fire me. And I left the stage. Well, you can see how that didn't go over so well, huh? I mean, people were sitting there wanting to be recognized, and I was saying, like, how can you recognize us for being a best practice when actually on our watch things got worse? The Great Bear Rainforest that just was declared a national park in Canada. When many of the environmentalists that fought there and tried to save that rainforest, they had a saying, not on my watch. These animals will not go extinct on my watch. Right? Well, on my watch, things got worse. And I wonder if you, in your quiet moments, are thinking that. We spend so much of our time here as an organization building up our children, helping children, but our conditions getting better for them, our less children having mental health issues, our schools becoming better places for children so they don't have that, our neighborhoods becoming more community oriented, and are they caring for children in better ways, are children having a better sense of belonging, do children feel more loved, do they feel healthier overall? And these are the questions that we ask, right? And yet many of us are declared experts in what we do and credited for what we do. But things aren't getting better, or are they? And so this is what happened for me. And that's when I started to say there's got to be a better way here. We've got to figure out how to get the whole community involved in this. And the community somehow has to change as a system so that children will have better lives, that people will have better economic conditions, and there will be less poor people. That's what I was worried about. There'll be less poor. I said, I don't want better poor. I don't want the poor to have better lives. I actually didn't. I wanted there to be less poor overall. It's like for children's mental health, do we really want children with mental health problems to live better lives? Of course we do. But really, I mean, our deep passion is to try to figure out how we have less children with mental health problems in the first place. And then how do we live as a society in order for that to occur? Well, collective impact has provided for me a better understanding of how we can create those kind of communities and create the kind of conditions in which children would have better lives, and there would be less children with mental health issues overall. So I'm going to take you through the 5 key elements of a collective impact. Just so that if you're taking notes, just remember the next slide actually tells you what the 5 are. But I'm going to go back so that you're not reading and that you're listening, and then just to know that you don't have to take notes because they're right there. The first one is a commitment to finding out who in the community cares and bringing all of those people together. This often takes 12 to 18 months, and having a lot of conversations and a lot of experientials and a lot of dialogue amongst ourselves in creative ways that will result in us having a common agenda, a common commitment. And in some ways, it's like a strategic plan. At the end of the year, we're going to have a community plan that is comprehensive and that addresses the issue of children's mental health. But it's not just the plan that we're interested. You know, Henry Mintzberger, one of the great business writers, became famous when he wrote a paper called The Rise and Fall of Strategic Planning. And basically, it felt like we were developing these plans for the sake of having plans. But he said, you know, the whole reason we're doing strategic planning is not to write a plan. It's to all get on the same page and move forward together. So I think that's really interesting. And so the common agenda in strategic planning has everything to do with building a common understanding and agreement together as a community system about what it is that we want to do together. What it is that we want to do together, and then how are we going to sign on to do that? Now, what's also interesting about this is that we're not just interested in agreement, we're also interested in the measures that it's going to take to get to that agreement. I think these two are sisters, that we can't really have a plan. It's not having a plan that we can measure, but it's asking what measures do we already have in our community that are going to enable us to understand what's really going on with children. And so often while we're developing a common agenda, we're also inside of that common agenda, and inside of that plan, we're developing a shared measurement system. And often we're looking at all of the data that we have available to us. And we're trying to understand as a system, which of these data points are we all supposed to be tracking? Which of these data points are we all supposed to be tracking to enable us to develop the kind of plan and the kind of shared measurement system that we are all committed to? I think that's really, really important here and exciting to try to understand. So we look at a common agenda, creating a shared measurement system, and that helps us work better together, to collaborate together. And you can see that immediately. You know, imagine if we wrote a plan, and there's 100 of us that are working together, and we wrote a plan, and we all signed on to the plan. That in the plan there are certain shared measurements that we've all agreed to, and all of us are going to bring those shared measurements into our organization. And as we get results, all of us are going to own those results. And all of us are going to have the kind of commitment that we need to implement those results. The exciting thing about that, it actually makes working together better and easier. And now we're not just collaborating in order to coordinate, we're actually collaborating to get something done. We have a community-wide plan. And it might be a 3 to 5 year goal that is going to improve the mental health conditions for children and families. That's what we call mutually reinforcing activities, a plan and a shared measurement system that gives us all credit for its success. And in doing so, all of us are improving our outcomes. And in doing so, we're all benefiting because of it. And what we're doing is we're contributing that which we know, all of the assets that we bring to this work in our community. We are bringing those all to bear together at the same time. And so what I look at collective impact is really the most highly evolved form of collaboration that we know today. Collective impact is the most highly evolved form of collaboration that we know today. And a better one's going to come. I know that. It will. But right now, if you and your communities want to make things better for children with mental health issues, the collective impact way, and you believe in a collaborative approach and have everyone working together, and that we have to work at systemic issues, not just individual issues, that it's more than transactional services that are going to help us. And like I said before, how many of you believe if we all just worked harder, things are going to get better for children? You know, we're already working as hard as we can. How many of you think if we just wrote one more report that things are going to get better? You know, if we just got a little bit smarter, right, that things are going to get better for children? You know, how many of you even believe, and I know that we often, it's so easy to believe that if we just spent a little bit more money, things would get better. If we had more money, we could do more. Yeah, and in the short term, things are going to get better. But guess what? You know, the example I gave you around Aboriginal children, when they had declared 10 years earlier and spent millions and millions of dollars on Aboriginal children in care. As a matter of fact, they spent a lot of money and put a lot of things into play that just caused more bureaucracy. So they spent millions of dollars to cause things to get worse, not better. And the number of children in care went up from 58% to 67% in a 10-year period after spending a whole lot more money. So if working harder, working smarter, and spending more money is not going to make things better, then what will? And this is our hope, that if we can work in a true collective impact way, and if we've truly brought the system together and working at the conditions for better children's mental health, that we can have a lot of improvements. And that doesn't mean that we stop doing the great transactional work that we do, but it does mean that we need to work at both at the same time. That's my deep belief. Now, there's two things that make collective impact really important. One is a great continuous communication system in which people are really knowing what's going on, and where we really are caring about what's going on in the community system. And the last one, and the one that maybe collective impact gives us the greatest contribution, is actually to fund a backbone support. That if you're going to have 30, 40 organizations working closely together and many stakeholders involved, it does mean that we need to invest in that. And that we can't just expect that organizations are going to do this off the side of their desks and that we're going to have a success. It's a lot of work to keep us doing all the things that we're doing. And most of us don't want to stop doing the good work we're already doing. So when we are developing a backbone organization, it is providing the core support that helps raise money for organizations that are doing this. It helps to work on joint policy initiatives as well. So those are the 5 core conditions of collective impact. And by the way, we have a question that came in, and I think it's about it. Could you speak more about how to implement shared measurement among organizations that do not, oh, hold on, I got to move this over, that do not all work with clients in the same way? Example, shelters and food banks don't collect client data. And that comes from, I'm not exactly sure. It said, is it Helen? The name has been, Eileen.
Eileen.
Yeah, hi Eileen. Great question. I mean, that's a really interesting question, and it sort of maybe goes to the core of the 5 conditions of collective impact. I mean, it's really not about just who collects data in the same way. It's really, as a collaborative, engaging in the data that is available. So I think the first part of shared measurement is not about measuring, it's about understanding. And it's about caring deeply about the data, as deeply about the data as we do about the relationships. So let me sink that in for a while. Let that sink in for a while. We've got to care as deeply about the data as we do the relationships. And in our field, we care far more about relationships and collaboration than we do about facts. And I know you can tell me that is not always facts. I get that too. But when we bring together intuitive wisdom and collective wisdom with good research, right, and good data, it helps us make better decisions. Now, When we're measuring, we're not so much interested in what are people measuring, right? As we are committing that the measuring we're doing um, helps us to better understand and better to learn from one another. How many of you have ever heard of Michael Quinn Patton? Don't need to do a poll. Um, Michael Quinn Patton is one of the top evaluators in the world today. And he wrote a book called Utilization Focused Evaluation. It's basically how do you do evaluations that you use? And his basic theory is that so often we do evaluation either at the formative stage, we're developing a new idea, so we evaluate it to see if it's having an early impact, and that we evaluate it properly. And then, but even more often than that, and almost all of our evaluation is summative. So at the end of something, or the end of a certain period, or the end of a project, we evaluate essentially to say, did it have an impact, and did we do what we were supposed to? Did we do what we said we would do? And government really wants to know whether they spent money well. And sometimes we learn from that, and sometimes we don't. And most often, it's just a report that ends up on the shelf. But when we do use utilization-focused evaluation, Michael Quinn Patton says, do this. Bring together all the people that care. Goes right back to the Meg Wheatley. And that want to learn something from the project. Bring them into the room first and ask them, what do you want to learn? And then he says, so what questions do we need to be asking in order for you to learn that? And how often do we need to be asking these questions? And out of that, they build the evaluation. So it's pretty cool, right? Then they build the evaluation. And out of that, then over time, this working group becomes the evaluation learning group. And they're learning from the data that's coming in. They're learning from the evaluation that's being done. They're learning how to then do, and then they ask, now that we know this, what's our next move? So part of the role of evaluation and shared measurement is not just to determine, are we doing things right, but they're asking, are we doing the right things? And then what should we do about it? So, it's in a sense, once you come to an agreement as a collective impact collaboration about what you want to measure, your partners become very involved and eager to give data, because they know that that data is not only helping us to understand whether we're doing things right or that we're spending money properly, but they're actually asking bigger questions that allow us to take the next move together and through our learning become more successful. This is just so it's easy for you to remember. And actually, later on, I'm going to have some slides. Matter of fact, I'm going to come back. But there is a slide here at the end that gives you all kinds of great resources that you can go to if you want to learn more about collective impact. It's amazing with websites that have been put together. But as you can see, I'm near the end of my presentation. And, people are often asking, how do we know that we're ready in our community for a collective impact approach? And we've come down to three things, and this is called the preconditions for collective impact. And that is that there are people actually who care in your community that are influential champions. And that could be anything from a mayor to an influential business leader to an influential social service agency. I don't think we have an issue here. Children's mental health, family health is huge right now. It's one of the top issues out there. So that's really great. The other one is, does the issue matter? Well, again, I think you're at the time where almost any community now could do a campaign around children's mental health. And if it was done properly in the collective impact way, you're going to get a lot of buy-in. I'm convinced of that. And then lastly, are there resources, adequate resources to fund the backbone organization, to even fund some of the activities that you've all agreed to work together on? And honestly, I feel if that's done properly now, money is not an issue in this field. I know it's an issue for your agencies because people are tired of us doing the same things over and over again, and they're wanting some form of community consensus. And I just found that when collective impacts are right and you've done that proper pre-work and you've got the whole system working together, getting money is not complicated because funders want nothing more than to fund community consensus. So if you've truly got a multi-sectoral response, and if you've truly engaged the whole system in agreement on what you want to do together, and that you've involved funders from early on in this process, the commitment to get funding, we have just found is not complicated when the issue is important to the community and there are influential champions involved in it. So with that, I really want to engage in your questions. I want to leave you with this one thought. When we dream alone, it remains just a dream, but when we dream together, it's the beginning of a new reality. Well, I think as much as I want to believe that, and I love it and it makes me feel warm, it's got to be more than dreaming. We got to have a process in which we are taking collaboration seriously, and collective impact does that for you. So thrilled to be here today, excited to hear your questions. Here are some great places to get resources on collective impact, and would love to engage with you. So where do we want to start?
I think Eileen had a clarification question that came from her previous question that you answered.
Okay, hi Eileen.
I think she said, so you mean you're talking more about information sharing than creating shared information systems?
No, I'm not. I'm saying that you learn together with the data that's available to you, and you ask yourself the question, what data don't we have that we need? And then what happens is, after you understand the data that's available to you, you start to ask which of this data helps us best understand the issue, and particularly helps us understand whether we're having success in changing conditions for children with mental health. So it's not just about having us share information. It's about, once we've shared the information, to agree which of this information helps us to understand and learn. And because we're learning together from the data that's coming in, from the shared information that's coming in, we're actually making better decisions moving forward. That's really how I understand shared measurement. It's having the collective data, caring about the collective data in such a way that we're able to make better decisions moving forward as a collective. That's why we all need that information, and that's why the continuous communication part is so important in all of this. And often the continuous communication is to engage in the data. So yes, it is about information sharing, and it's about, once we understand what it is we want to do, then it's about creating a shared information system.
But Eileen also just put a clarification point saying that she's just completed a needs assessment for 4 agencies that agreed to work together to address poverty, but they are now struggling with what shared measurement entails. So just, I guess that gives you some context around where they're at and where this question is coming from. I don't know if you wanted to add based on that.
I would agree. I mean, I think, again, I would ask some questions. The first one being, have these 4 agencies deeply tried to understand what is poverty in their community, what's the data points around poverty in this community, and how it is that what we have to start to look at to better understand their the needs of the community. And so, part of it is, are people becoming less poor? That would be one of the data points. And the way that we often look at data points around less poverty is that we pick one of them, like LICO, and we start tracking household income, which you can do annually based on tax filer data, right? So, and tax filer data is freely available. So these are some of the ways and some of the things that we're looking at. But people might say, well, that's too broad. We need stuff that's narrower. And that's where we start looking at some sort of neighborhood outcomes. We also are just looking at activities. So we say, if we've taken on 15 or 20 projects as a community related to that, how are those projects helping people? And in poverty, we use the Sustainable Livelihoods Index. All agree that those 5 principles are what we're monitoring, and then we're monitoring toward those to see if we have outcomes that are changing things. I hope that helps a little bit around shared measurement. Honestly, Eileen, shared measurement is often the hardest one to understand. And do connect with me offline, and I can pass on some resources to you that you might find quite helpful. But if you go to the collectiveimpactforum.org, or if you go to tamarackcci.ca, those are both places where you're going to get a lot of help with this. Also on our YouTube channel, Faye Hanley Brown and Mark Kabaj, who I consider the 2 most important people in North America who are talking about shared measurement, spoke at our conference together last year in Vancouver, and we've taped the session that they did on shared measurement.
Great. Thanks, Paul. We have another question, and that's a long one, so you might want to follow along while I read it. This one's coming from Debbie, and it said, could you discuss cultural safety as an outcome for collective impact and its role in collective impact within systems and policy, specifically within Canada, First Nations, Inuit and Métis inclusion, and cultural safety as a measure for sustainability, and that collectively impact both on and off reserve Aboriginal members who access programs and services. My understanding is that cultural safety also requires a high level of trust. This discusses the imbalance of power within systems, not just between service providers and service providers, but within the broader society. So I'm curious, as you mentioned this as part of an example from First Nations children in Alberta.
Great question, Debbie. Oh my God, did we struggle with that one, huh? Like really, it's. So here's what we did first of all, is that we didn't think that we could do anything. And we had Aboriginal people on our team. Absolutely, the majority of our team. We had a team of 8. But we knew that we needed to go work with the elders. And so the way that we created cultural safety is that at the event, we were not at the forefront, the elders were. And we would have between 5 to 7 elders at every event that we ran. And the elders would do the opening. They would recommend us. At every event, we did a pipe ceremony the night before. We often did a feast, and we called in the ancestors to come and help us. And then during the event, the elders were the first ones to get up. And there was maybe the highest ranking official from that region, from Children and Family Services that would speak, but there was also an Aboriginal leader that would speak. So in addition to the elders, an Aboriginal leader, the highest ranking Aboriginal leader in the room, would also speak. Even myself that was leading the sessions, I took no more than 7 minutes to introduce the exercises, and bang, we were in. The other thing is that we made sure that an absolute minimum 60% of the people in the room were Aboriginal. So we didn't care that we had this system matrix and all these power imbalances. Lastly, we only had first names. So when we held this event, we only put first names, we put no titles onto people's name tags. So that we tried to sort of work at this on the human level. And it was really only through people's stories did you know who they were and why they were there. And it was then up to them if they were willing to share that. Unfortunately, we held almost all of these in hotels because with 100 people, it was just hard to find a community facility on an Aboriginal reserve that could do this. at this level. Now, that's what they said, and I wasn't 100% clear on that one, and I would have much preferred to do it inside of Aboriginal facilities. But we did take precautions, and they're very human ones. I hope we did well. I don't know what you think, Debbie, if that seems to be what you're talking about, and did we take the kind of conditions that are necessary in order for this to work? Interestingly enough, I don't know how that's applicable, generally to a general community, but with Aboriginal communities, we tried really hard not to be the ones in the lead, and that this was being led by elders, um, and using very much as possible cultural practices. I hope that helps.
It looks like Deb is typing, so we'll see if there's more to her question. We don't have any other questions, but we still have a bit more time if anyone wanted to pose a final question. I'm seeing some people type, so you may just have to give it a moment, Paul. I don't know if you wanted to speak. I know you said that there's much more that you could say in terms of increased collaboration and the implication of increasing trust. So I don't know if while people are typing questions, we wanted to maybe, if you wanted to talk about that more in depth.
Well, first of all, I'm going to give you my email address so that if people afterwards want to just communicate with me directly and have a question instead of doing it here, I'm okay with that for sure. So here it is, paul@tamarackcommunity.ca, and I'll try to get back to you as soon as possible. Okay. So, Mary Lou.
We do have another question now.
Mary Lou, I wish I had. I know there is some on the collective impact forum. I'm not an expert on cultural safety work. I'm just not. And honestly, my advice to you, I mean, I'm sure there is stuff out there that has been written by Aboriginal communities, and if you have any, I would love to hear you put those up. But for us, it was the elders. I didn't do any research or anything. I just trusted them, and they didn't let us down once. Matter of fact, wow, I learned so much from the elders that we worked with, and always we would go in advance of these to every region, and we would work with very credible elders that we knew that had been involved in this work before. I did this work through the Aboriginal Engagement Division of the Alberta government, and so we had a pretty good selection of elders that we trusted and worked with closely. So I wish I had better resources on that. I'm not an expert on Aboriginal engagement, other than I had this amazing experience in my life that lasted for almost 18 months, and that I am so deeply grateful for, because I grew much more than I was able to give. It was truly remarkable and lovely. I think all of us on the team felt the same way. Oh, okay, the dream quote. Oh, someone did that for me already, just like that. I wish life was that simple. You ask a question, someone asked and we could go back one slide. I like that. I added the apples. That was not in the quote. Debbie, Allison Hall, and Debbie are typing. Oh, Allison's just saying thank you very much! Exclamation mark. So I think that's kind of like a smile.
Oh, and
I'm
Debbie
happy with how you approach your work, Debbie said, and I hope that those approaches become part of the shared measurement as an approach to systems transformation. That sounds like an affirmation as well. Thanks, Debbie.
Well, it looks like there aren't any other questions, Paul, so maybe we can just do our closing. What do you think?
I would love to do the closing. And just to know, paul@tamarackcommunity.ca, if you want to do more. If you're interested in learning more about collective impact, if you go to our website, tamarackcommunity.ca, you can sign up for all kinds of things, but one of the ones I'd sign up is for Engage, and it's our e-magazine, and it's free, and it's just top of the line. We put a lot of energy into that. We do a lot of research in this area, and all of our resources online, which are just hundreds, and all of our webinars and most everything we provide is free. So it's all there for you. Um, so that's a great one to go to. Um, there are also all kinds of events that we try to make as affordable as possible. For some, they're a bit pricey, but they're really great events. They run 3 to 5 days on community change and collective impact, and we run 8 or 9 of those a year. So there's always something going on in a city that you might really enjoy. But this last one here, if you're a tweet, go to Twitter. Just joking. But Collective Impact Forum is a great one to follow. But then this collectiveimpactforum.org is a global website, and it is truly world class and literally has every resource ever produced and great blogs on almost every issue, including children's mental health, are on that forum. So again, if you're interested in collective impact and looking at community-wide transformation, that's really important. For those of you also in this on this call, know that the Trillium Foundation is making collective impact a major funding priority. And I think that's really important for you to know because we're supporting Trillium in this work. And so it's another one for you to be able to get involved in and to get direct support in your community for a collective impact approach around this issue and others. So just wanting you to know that there's a lot out there right now around collective impact and working on a systemic level, both on a training level, but also on a funding level.
Great. Thank you, Paul. I can certainly say that this is a really great presentation, and you've seemed to capture our audience full attention because no one dropped off for the whole hour of your presentation. So thank you very much for this session today. And thank you to all those participants here today that took the time to join us for our final e-forum. And just as a quick reminder, if you wanted to go back to today's session, we will be posting this online following the event along with Paul's slides, so you can refer back to those. And again, if you want a participation certificate for today's event, just feel free to reach out to me and I can facilitate that for you. And we will be posting an evaluation link for today's session, so please fill it out. We want to hear what you thought about today. So thank you. And I think that's it, Paul.
Wonderful. Thank you all.
Yeah, and judging by people's comments, it looks like they appreciate it too, today's session too.
Yeah, thanks.